A recent report from the Organization for Economic Cooperation and Development looked at which countries take the most antidepressants. And you might be surprised, but Canada came in third after Iceland and Australia. Global National's health specialist, Dr. Ali Zentner, joins us to talk more about this. So are Canadians being overprescribed when it comes to antidepressants?
You know, I think that's the big question of this study. So the OECD is a study that looks at 34 countries in the developing world and in developed countries, and it looks at determinants of health. So things like tobacco consumption, alcohol consumption, and risk factors for disease. It also looks at prevalences of certain diseases, such as depression and cardiovascular disease. And then it looks at the ability of access to health care. So things like how many patients are taking medications, do they have access to care? This particular aspect of the study looked at 18 of the 34 countries. So first of all, America was excluded from this analysis. Canada, yes, ranked third. But I also would argue that places like, for example, Sweden ranked fifth. And, you know, we often compare ourselves to Sweden as one of these optimal healthcare delivery systems. The big question is are we overprescribing Canadians too much antidepressants? Or you could actually look at the converse. Are we appropriately treating people who do indeed suffer from depression and mood disorders?
So what are the conditions that necessitate antidepressants?
So this is where...
It's not just about depressed people. There are other conditions.
No, absolutely not. So this is mood disorders in general. And this is where I draw information from the Canadian Community Health Survey. We have 2012 data that shows that approximately 10% of Canadians suffer from mood disorders, including major depressive disorder, anxiety disorder, and bipolar affective disorder. So if you look and sort of extrapolate that data relative to this, I would argue that no, indeed, we are not overprescribing antidepressants for the most part, but we may indeed be treating appropriately those 10% of Canadians who have legitimate depressive disorders, legitimate mood disorders, where you have a biochemical imbalance in the brain that requires treatment.
All right, Ali, thanks so much for that.
Thank you.